So my entire career, I have been interested in the effects of information on consumers and markets. And I see healthcare as having many of the same, or many interesting parallels to areas where I have worked, like online shopping. And the questions that I want to ask are, when do consumers demand certain kinds of information that could create value for them and for the system? And what are the incentives of the channel members to provide the information that could provide that value for consumers? If you go to the next slide, please. One of the topics I find very interesting is pricing. So the U.S. healthcare system expenses have increased sixfold in inflation-adjusted dollars. If you look at other markets where that's happening, like for example, higher education, there's always some underlying reasons for the lack of consumer price sensitivity. And a lot of people have identified certain issues that contribute, like third-party payers, insurance systems that caps out of pocket, so why should I economize? Sacred profane trade-offs when it's trading off a month of life for something that's financial. But the topic that I would like to highlight is one that comes from Chris's colleague, Peter Ubel, about the opacity of pricing. Even so, it's not, I guess, I don't find it surprising that consumers don't understand the prices that they would be charged for the same treatment, say a major hospitalization at different hospitals. They rely on doctors. But what Peter has shown is that doctors themselves do not know the prices, nor do they think that it's their job to know the prices. When I've had situations where I've asked my doctor, well, how much it would charge to have this test done here versus there, they view it's impossible to know, but it depends on your health, on your insurance system, et cetera. It's not my job, et cetera. And so one of the things that I find very interesting is just, again, analogous to the online retailing domain is, when does a situation like that create opportunities for information infomediaries who would help the doctors understand, actually, if I send my patient to this provider versus that, or some sort of ancillary care, what will the pricing be? So anything that we can apply from our literature to think about how to get some price sensitivity in the literature, if not from the consumers themselves, to parties inside the system, inside that affect that pricing, the prices paid. We go to the next slide, please. The other, so that was one of the issues that I've been concerned with a lot, about how information affects price sensitivity. But I have also had a lot of interest over my career in how information affects quality sensitivity. And this is I think, building on some of what Poonam said earlier. I see opportunities for marketing scholars to create models for information exchanges that would improve the quality of healthcare. Right now, the Hipaa privacy rule requires that appropriate safeguards to protect the privacy of personal health information, and sets limits on the conditions on the uses and disclosures that may be made of such information without patient authorization. And it also gives patients the rights over their health information, including rights to examine and obtain a copy of their health records and to request corrections, et cetera. So that's what the law requires. But I think there's basic descriptive research needed about how many consumers actually know who has what records over the course of their lives, if they've been treated by various providers, and how does this affect the transmission of health history information that could benefit care? One of the issues is just that even though the Hipaa law says that that information is supposedly ours, we aren't the holders of some central of our own information, nor is there any central repository. And so the question is, are there models to allow consumers to share their health information in a way that benefits them and doesn't lead to exploitation? I see this as very analogous to the literature on customer identification, customer relationship management, and advertising, pricing, and personalized recommendations. Whereas if some seller knows something about me, or in this case, a healthcare provider knows something about me, that can have benefits. But the reason it doesn't happen is because of risks of exploitation. And I think that marketing scholars have the opportunity to make major contributions to society by providing models for patient ownership and sharing of health information. Thanks very much.